And good morning. This is Dr. Deuk here at Deuk Spine Institute, and I have a very special patient with me today. She's a nurse, and we were just talking about where she practiced nursing. She's from New York, Long Island, and we were talking about how my dad was a doctor up in Queens, my mom a nurse in Queens. But you're here today because you've had surgery on your back 6 weeks ago.
Yes.
Why did you have back surgery done?
Because I fell at work, wet floor, no signs were up, went flying, and ever since that day my life hasn't been the same. Pain, spinal fusion, rods, plates, 10 bolts.
Yeah.
It was a lot.
As if being a nurse isn't hard enough, then you have a slip and fall on top of it.
Exactly.
So now we did laser surgery, Deuk laser disc repair 6 weeks ago, right?
Yes.
And you had a fusion already in your back, and we did the laser surgery. Was it above and below?
That was the T-lift.
Oh, we just did the bottom. We did the bottom below.
Because of Workman's comp.
Okay, got it. All right, and how are you feeling 6 weeks after your back surgery here?
Well, I have to say, when I woke up, my back, where I normally had horrendous pain, was gone.
Immediately?
So, immediately. I woke up, I was like, oh, it's wonderful.
Yeah.
It changes how you feel, how you wake up, how you go about your life. And before being in pain, it was very depressing, it was very painful, and you didn't want to do anything, you just wanted to hibernate. And that's what I did, but not now.
As a nurse, you were hibernating, right?
Yeah, as a nurse I was.
And you're not used to being the one with pain, you're used to treating patients with pain.
Exactly.
So how did you find out about Deuk Spine Institute?
I actually did studying, and I researched a lot before I made the decision to come here. And I was very impressed by your expertise and how you treat the patients with very, compassion, kindness, and you want their pain gone.
Yeah.
And you have definitely, and all your staff, and they've been wonderful.
Oh, thank you. Well, the reason why we're doing a video is because I want to spread the message to people that they don't have to live with back pain, that there is now a cure for back pain. Would you agree that there's a cure?
I'm 100% living proof.
And how much are we paying you to say that?
0.
Right. None of our testimonials from our patients, we don't pay any of them. And so I just want the audience to know this is a real, genuine patient who suffered with back pain. Your injury when you slipped and fell was how long ago?
That was in 2005.
Wow.
September 9, 2005, 8:30 in the morning. I remember it like it was yesterday.
Of course. So for 15 years, you've suffered with back pain.
Yes.
And were you offered other treatments?
Just to, to help reduce the pain. It wasn't permanent, but just temporary, like radio frequency ablations, epidurals, facet blocks, all of that.
Did they work?
The radio frequency worked better than anything else and a little bit longer, but no, it was just temporary.
Temporary. And now you're 6 weeks post-op and you feel like maybe this is it.
Yeah, absolutely.
Good. I agree with you.
I love it. I'm so happy. It's like a miracle.
We're happy for you as well. Are you have any plans to go back to nursing?
Eventually, after I get my neck done by
Okay.
you.
All right. What's next? Anything you want to say to our audience before we wrap this up?
Definitely would give the Deuk Spine Institute a try, because I did, and it has totally changed my life, and I appreciate them so much. And I appreciate you.
Thank you very much. And I just want to say one more thing. Since we're doing this interview, she's a work comp case. And, before I started taking care of work comp patients in 2004, everyone told me, you want to stay away from work comp, don't take care of work comp patients because they're all faking it, they all want to just secondary gain, malingering, trying to get money. Of course I believed that coming out of residency, and then I started to take care of patients in work comp, and I realized they're not faking it. The problem is the doctors can't figure out what's wrong with them, so the doctors blame the patients and say, you're faking it because the doctor can't figure out what's wrong. So when doctors don't put their egos in check, they tend to blame other people for their shortcomings. And this is something I've seen over and over and over and over again. And I think people need to know about that, because I think there's a lot of people suffering out there with back pain, neck pain, that they've been told by people they trust, the doctors, that it's all in their head, that it's them, that the problem is with them. And I don't believe that. I truly believe these patients, I can examine them, I can tell that their pain is localized to the problems on the MRI. I know they're not faking it, and when you do the surgery on somebody like her and get them better, it changes their life. It means a lot.
I want to say one more thing. Being in pain and being on heavy-duty narcotics, I did not want to be on them. And now I'm totally off of everything.
It's wonderful.
I only take, like the Flexeril.
Muscle relaxation.
Yes, that is it. I'm off of everything. And it's like, I've always wanted to be that way.
Yeah, those narcotics mess with your brain.
Oh, yeah.
Change your whole life, your personality, everything, in a negative way.
Exactly,
Yeah.
exactly.
Well, great. Well, you're on the road to full recovery, and I'm very happy for you.
So am
All right. All right. You take care.
Thank you. Mwah.
You're welcome.
I love you.